The Bright Spots programme is all about changing the culture of children's services.
It's more than a research study. It's about bringing children's voices to the heart of social work practice.
Oxford researchers and Core and Voice have worked together and collaborated with children in care
to call attention to what they thought makes their life good.
Children's satisfaction with how often they saw their parents really mattered to their well-being. The question wasn't whether contact was or wasn't happening. It was whether children felt that the contact was right for them.
Most children were not satisfied. Many wanted more frequent contact, and some wanted less or some none at all. Only half of the young people felt that they were involved in the decisions and that their views were really listened to.
Others felt that information had been kept from them about why they couldn't see birth family members, and they wrote about really needing to know.
Frequency of contact really matters. For every 10 children in care, 2 to 3 feel that they see their parents or siblings too little.
When we looked at what stopped contact happening, there were several things. Firstly, there was the difficulties that parents experienced, such as their mental health problems or problems with substance abuse. There were visits that were set up in contact centres that were a long way away or cost far too much for parents to visit, and also set up at times when parents were working. Dissatisfaction with contact was also caused by children's accounts of formulaic and static plans that didn't change with the child's age or with changing family circumstances. Children wrote about wanting to see a whole range of important people in their life.
For example, their grandparents, step-parents, or their pets.
But they were often excluded from the planning for contact. Being flexible and adjusting contact plans over time is essential.
While most children wanted more contact, between 2 and 3% wanted less. It might be surprising that a quarter of 11 to 18-year-olds had no contact with either parent.
The reasons for that were complex. Sometimes young people themselves had decided that continuing contact was not helpful for them. Their parents may have let them down on many previous occasions and not turned up for contact.
For some young people, for example those seeking asylum, their parents didn't live in the country. And for others, their parents had died.
We found that 7% of young people's mums had died, in comparison with 1% of children in the general population. This is a new finding from the study.
Our findings are based on a research project conducted by the Rees Centre at the University of Oxford in collaboration with Core and Voice, a children's rights charity. The survey includes questions about relationships as they're central to well-being.
And those surveys had been co-designed with care-experienced young people. Over 7,500 young people completed those surveys, and 3,084 provided written comments.
Based on this project, the team would like to encourage social workers to really listen to children's views on who they want to see, where and how, and try to make this possible.
If that can't be done, children need to be supported with their disappointment and upset.
Overall, it's essential to normalise contact. Children wanted to be able to do everyday activities, like going for a walk, playing games, or going for a meal. Whenever possible, allow children to meet their families in the community, perhaps involving foster carers or other relatives in arranging and supervising.
If contact centres are used, use them actively to support parents and help them improve their relationship with their children.
Making sure that children feel that they're listened to
is key to their well-being. We'd like to thank all the local authorities who took part, and to the thousands of children and young people who completed the Your Life, Your Care surveys. Thank you.